if you want to be a fetal medicine person, you have to be an emotionally invested person. Okay. See, this is not a speciality where you should come thinking that, overnight I'm going to be a success, overnight I'm going to make a lot of money and I'm going to be rich and famous. This is a specialty where you have to be emotionally invested in the fields. There will be more setbacks than success initially. And if you are emotionally strong enough to hold those setbacks, you can take up this process. Most of the time, the alkar fetal medicine obstetricians especially now, this maybe obstetricians might not like. I've told my fellows also, fetal medicine the night calls avoid mostly. But obstetrician life is very busy. Night calls delivery. This is the glamorous part of obstetrics. You can do scans, you do procedures, you go back home. Nobody is going to bother you. You are leading a life inside an air-conditioned room. You don't have to run to but that is the outside picture. But the inside picture is, whenever you do a scan and you tell that this baby is okay or this baby is not okay, you're taking a huge risk on the life of that patient, day in and day out. And if you're willing to live with that okay, I am making a decision for a particular life. If you are willing to live with that, and if you are able to emotionally be able to come to terms with those feelings, then take up fetal medicine. Don't think that okay, it's an easy job. And you can do other professions also where you have very good success rates. Right. For example, laparoscopic surgery and all, it's very good. If you're a good skillful surgeon, it's a very satisfying field. You can absolutely do and excel in that field. But in these cases, sometimes you will have borderline cases. Right. For example, recently we had a case in which testing was done on the fetus, and for that fetus an abnormality came on genetic testing. A genetic report that the baby had possibly a Kabuki syndrome, which is a very rare syndrome. Our report is a patient and it is a genetic proof that the baby is abnormal. We did the scan is completely normal. We told them that the scan looks absolutely fine. This finding that I'm seeing here is dangerous. Okay, that means this child could have some problem. But before we do anything else, let us test the parents. So we tested the parents and the mother was carrying the same mutation. Means even though it was a dangerous mutation, it was not going to affect the child. No. And we told them to continue the pregnancy. But that takes a lot of risk. In our minds, again, there is that fear. But then we took the decision based on the evidence. And sometimes hard evidence will tell us that we should take a strong stand. And if we play the safe role, safe and terminate here. You are safe, everything is safe. But that is not the right decision. Invariably, decisions have to be made, and those decisions are going to be hard. And if you're emotionally strong enough to take hard decisions, take it. And that's the only aptitude you need.
So I think what I could understand from this, I think good communication, yes, honest communication, counseling, and be empathetic.
Yes, very, 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 very important. Because for the mother, for the husband, for the family, there are lots of people. But for the fetus, there is only the fetal medicine specialist. No one else.